Hello, everyone. This is Jason from Digital Health Wire, and I'm excited to be joined by Scott Schweiger, who is the VP of the clinic by Cleveland Clinic. We're coming to you live from ViVE in Nashville. Scott, it's good to see you.
Thank you for the introduction. Thank you for the opportunity.
Perfect. So what is the latest and greatest at the clinic that you're excited to be sharing with folks here at ViVE?
Well, we are a virtual second opinion offering in the market. So our goal is to deliver an informed decision to our members, consumers, and our payer partners for their populations.
Mm-hmm.
We have, really three primary areas that we are trying to solve for. And the fact is 6 in 10 people have a chronic condition, and 50% of those have a comorbidity or another condition. Two, there are roughly 12 million misdiagnoses in the United States annually. So, and that also contributes to some of the issues with the third and probably the most important, various care deserts that exist across the nation with people getting access to specialty care.
And I've seen some interesting stats. So you guys actually change or impact the diagnosis in over 50% of cases. Is that?
Yes, over nearly 70% of our population that goes through a virtual second opinion has a recommended treatment change to their condition. The value that we bring to that piece of it is when someone is going through a virtual second opinion, we are delivering that second opinion back to their primary care team. So if you think of the three-legged stool of the payer, the provider that's involved with their treatment decisions, and the member or the consumer, it's the three-legged stool where we are driving that value back to the entire team to essentially lower cost and mitigate further risk with their condition.
And on the B2B side, not the direct-to-consumer component of it, but what are some of the big pain points that people are coming to you with that you're hearing over and over again and helping address?
Yeah, great question. So, a lot of our B2B partners are the payers, are the brokers, are the conveners in the market. And for them to be able to offer a member-centric solution or benefit to their populations is just critical. As I go back to 6 in 10 people have a chronic condition. So they are needing the help and the support and that complex specialty care expertise to their conditions. So, we are essentially lowering their medical cost. We are helping them with care deserts that they're experiencing. A lot of plans are witnessing their provider network shrink or consolidate, and that just means there's some loose gaps in covering the population. 80% of rural America is seeing a decrease in provider accessibility, and so when you offer a virtual second opinion, we're able to help fill that gap.
Perfect. And what are some of the big trends that you think are going to make a huge impact this year? Maybe on the virtual care side, or that maybe people might be underweighting that your boots on the ground are really seeing as important?
Yeah, well, congratulations to ViVE, and when you walk through the room, you have hundreds, if not thousands, of partners trying to enhance and enable the healthcare landscape. If you walk that room and you peek your head into some of the discussions happening, one of the top 10 that they're trying to continually deliver specialty care to the populations. So we continue to work with our payer partners, our provider partners as well, and to deliver that specialty care to their populations.
Nice. And what are you most excited about that either your providers or your patients can look forward to this year, next year, but in the near term?
This is just going to keep getting attention. One of the benefits that we offer a lot of our partners, especially on the B2B space, is this is not an all or nothing solution. We can dive into an MSK or a cardio or an oncology condition for them. We can just start. The truth is that probably over 50% of the payers that we call on still rely on their provider network to offer specialty service conditions and all that to their populations. We can come in and be just a piece of that. And as we build the partnership and we get to see results across any of the chronic conditions they want to jump into, that's typically where we get the opportunity to expand in other conditions where they realize they need the help.
And since I'm legally obligated to ask you an AI question this year, do you find that more and more of your patients are turning to ChatGPT first and you're kind of evolving into a virtual third opinion service? Or What is the big impact there that you're seeing?
In God we trust, all others use data, right? And we see the population wanting data. They want to be informed on their medical conditions. So we see what we're offering is complementary to the research and the study that they're going to take, and the accountability they want in helping themselves to find better opportunities to get well.
Well, Scott, in God we trust, in the clinic we trust. It was great talking to you
Thank
today.
You as well.
Thanks everyone for tuning in to the Digital Health Wire show. We'll see you next time.